Obsessive-Compulsive Disorder: Causes, Effects, and Management. Obsessive-compulsive disorder, OCD, is a common, chronic, and long-lasting disorder where a person has uncontrollable, reoccurring thoughts, obsessions, and behaviors, compulsions, that they feel the urge to repeat over and over. Signs of OCD typically include both obsessions and compulsions, though it's possible to experience just one or the other. Obsessions are recurrent and persistent thoughts, impulses, or images that cause distressing emotions such as anxiety or disgust. Compulsions, on the other hand, are repetitive behaviors or mental acts that the person feels compelled to perform in response to an obsession, or according to rules that must be applied rigidly. The mental health impact of OCD can be severe. An individual with OCD may spend several hours a day focusing on obsessive thoughts and performing seemingly senseless rituals. This can interfere with daily activities and cause significant distress. Additionally, the chronic nature of OCD means that it can be a lifelong struggle, leading to feelings of frustration, guilt, and depression. Looking at the causes of OCD, it's important to note that there's no single, identifiable cause. However, several factors play a role, including genetics, brain structure and functioning, and environmental factors. Importantly, one environmental factor that can contribute to the development of OCD is childhood trauma. Traumatic experiences in early life can alter the brain's stress response system, making a person more susceptible to anxiety disorders like OCD. These experiences can create a pattern of perfectionism and excessive self-doubt that contributes to OCD symptoms. Research indicates that genes play a role in the development of OCD. Individuals with first-degree relatives, such as a parent, sibling, or child, who have OCD are at a higher risk of developing the disorder themselves. However, having a family member with OCD doesn't guarantee that you will have the disorder. Some studies suggest that people with OCD have differences in specific parts of their brains, but more research is needed. Imbalances in the brain chemicals serotonin and glutamate might play a part in OCD. Certain environmental factors can trigger OCD in people with a predisposition toward developing the condition. These include significant life changes, such as starting a new job or the birth of a child, as well as behavioral influences, such as habits related to cleanliness or safety. Traumatic experiences in childhood, such as physical or emotional abuse, neglect, or other stressful events, can be significant factors in the onset of OCD. These experiences can trigger a tendency towards obsession and compulsion in an attempt to gain control over one's environment. It's important to note that these factors do not act in isolation. The development of OCD typically results from a complex interplay of genetic, neurological, and environmental factors. Each individual's experience with OCD will be unique, reflecting their own specific mix of these influences. In terms of healing or managing OCD, it's crucial to remember that there's no cure for OCD yet. However, treatments have been found to be quite effective in helping to keep symptoms in check. Cognitive behavioral therapy, CBT, is often employed, which involves retraining your thought patterns and routines so that compulsive behaviors are no longer necessary. Medication, particularly selective serotonin reuptake inhibitors, SSRIs, are also used to control the obsessions and compulsions. Finally, self-care practices such as regular exercise, proper sleep, and a healthy diet can be beneficial in managing OCD symptoms. It's also important for individuals with OCD to learn stress management techniques and seek support from loved ones or support groups. In conclusion, while OCD is a challenging disorder that can greatly impact a person's quality of life, there are effective treatments and coping strategies that can help individuals manage their symptoms and lead fulfilling lives. If you or a loved one are struggling with OCD, it's important to seek help from a mental health professional. By Łukasz Kravitz.